sound free, except for Rich's birds in the background. A sound free. So good to see you. Glad you could join us, Livia.
Yeah, good to be here. Can you hear me all right?
Yes.
Oh, wonderful. Okay, good.
Perfect.
Thank you for inviting me.
Yes. And I was telling Kathleen that John Erickson was going to join us. He is the director of Planned Parenthood in West Hollywood. And he got called into an emergency meeting on the vaccine. And of course, they scheduled it during our program. So, but we have two wonderful people joining us today, and I think it's going to be exciting. So let's go ahead and begin. My name is Liz Cannon. I direct our LGBTQ+ Resource Center here at UW-Oshkosh, and my pronouns are A, M, and airs. And I am joined with my colleague, Rich.
Yes. Good afternoon, everybody. Rich Marshall. I work in the career and professional development area, and my pronouns are he, him, his, and very happy to collaborate on this and for our participants to get the first-hand perspective from our amazing panelists today.
So for our series, Queer and Trans in the Workplace, today we are focusing on community health services. And I wonder if each of our panel members could introduce yourself, names, pronouns, how you identify, if you're comfortable sharing, and tell us a little bit about what you do in the field of community health care. And let's start with Kathleen.
Hi, everyone. I don't know who all has joined us. My name is Kathleen Muskee, she, her, hers, and I do identify as queer. And I am a licensed professional counselor. I work with all ages as far as individual, family, couples, and group therapy. And then I also have a specialty. I do consultation for mental health issues regarding opioid addiction.
Thank you. Livia.
Hi, everyone. My name's Livia Rowell-Ortiz. My pronouns are she, her, hers, or given the opportunity to speak Spanish, ella. How I identify. I guess you could say trans woman is probably the way that most forms would want me to be seen, but yeah, trans I think is probably the thing I'm most comfortable. Trans, queer. Beyond that, it gets pretty murky, but that's how words and trying to figure out who you are works. So I'm on the path. And I am the raíz organizer, that's Spanish for root organizer at Planned Parenthood of Wisconsin. That means that I do a lot of Latinx outreach around days like today, election day, and polls close at 8, and other kind of advocacy paths that intersect with healthcare. I think that unfortunately, politics and opinion and a lot matters when it comes to healthcare. And we know how quickly things can change for someone's particular status in relation to access. So that's what I work on. Okay. And I guess just to finish that thought, that I work kind of statewide, but also primarily out of the Milwaukee area, just to clarify.
Wonderful. Thank you both. I'll start with our I guess first question beyond the introductions here. So what led you to choose this career path? Early in your career, what did you think this particular path would be like for an LGBTQIA+ person? Optimistic, worried about discrimination, etc. And we'll start with Livia.
I think for me, advocacy led me to being at Planned Parenthood. And I love the mission of Planned Parenthood. As a queer person, I have felt nothing but welcomed here by my colleagues, and it's definitely been, even though it is Planned Parenthood, an organization that really strives to be progressive, it's still been kind of a challenge, a systemic challenge to, I would say primarily for us to offer things like hormonal care for trans folks, like statewide, which is something that we can do right now. Like it's really difficult, or it was difficult being at an agency that I knew that other Planned Parenthood affiliates in the nation had offered hormonal care, like those in many, Minnesota or Illinois, and very proud too at the same time that they were offering those options, and that we were on the path to be there. So I think that for myself, I'll speak from my own personal experience, being queer and being trans really had an element of survivability to it. I think that you need to know, in order to change your name, you need to know how to go to the court, pay the filing fee, get the right forms, file your name in a newspaper for 2 weeks, hopefully you have your birth certificate. So you're kind of navigating systems that you maybe wouldn't otherwise. And I think just even in trying to assess being employed, I think that might be one of the follow-up questions here, but I think having to advocate for yourself so often that it was kind of, that's the way that I ended up being where I am. And so that meant for me taking the opportunity to, when I saw it, to make a change. So it would be like little things. One year in Pride Fest Milwaukee, here, I think that's like June 7th, 8th or so, the Summerfest grounds. I was simply walking with my friends to go to the bathroom, and it was clear, of course, Summerfest is extremely packed, that someone was going to run into myself and my friends, and we were all trans, like kind of visible, but it's Pride Fest. So, but the person behind me had a back condition, like she actually had, she couldn't be in crowds or otherwise, because if she was touched, it would cause her immense pain. And so I could see someone was coming at us, and so I decided not to move. And then they ended up actually running into me, and then yelling like some kind of transphobic slur over it as we were going into the bathroom. Something very lightly controversial, but that ended up in several conversations with Summerfest board members, with other folks there who had claimed that they had a trans inclusive policy in their bathroom since the 90s. And so it became very controversial of whether or not to state that your bathrooms were inclusive or not of trans people, and where the line was drawn, quote unquote. And now every year since, they have signs or otherwise that state, what they had or said that they had in terms of inclusivity. So I think for me, it was, yeah, I'll let others speak, but taking that opportunity when it comes to you, and having good friends around you to help you with that.
Yeah, thanks, Livia. Kathleen.
Yeah, so when I entered the field of mental health, and that would have been quite a while ago, many years ago, I was super excited. And I mean, I don't think I was unrealistic or too idealistic, but I was excited because my master's program really dealt with queer issues pretty well, as far as being able to talk about it, being able to imagine how things like that. And just like Livia said, it is taking those opportunities when they're available, because that's what you have to do. Because one of the things that I've watched for the last, say, decade is, the whole preferred name policy, because in my field, everything revolves around documentation. And so preferred name policy really impacts that, and it impacts people's lives, so how they're experiencing things. You can have a preferred, like, it's much more common now like in the last it's just exploded where it's not like 10 years ago, even it was hard to imagine breaking through those barriers. You know, maybe Liz, maybe you can give me a better timeline. 10, 15 years ago, would you say? Yeah. And so it's more common now. You're going to find that there's preferred name policies in a lot of places, but that doesn't necessarily mean that there's acceptance and understanding. You know, that's where it really hits the road. You know, it's those, you know, you as a queer person, you know, you run into those pockets of resistance. And even though, you know, your whole like clinic or your whole agency is supposed to be, you know, diversity, inclusivity, and all that, that still doesn't mean that that's what the environment is like. And so like the previous speaker has said, you really have to rely on people you can trust, because you don't know where people are coming from, and they're not necessarily going to be open about it. But I do think there's a lot to be optimistic about, because it's becoming more expected, even, that you're going to have preferred name policy. You're going to address these issues, like it or not. You know, you're going to do that. So I think that is reason to be optimistic.
So it's interesting that both of you are talking about places where, because of outward signs, obviously Pride Fest, right? And then a clinic that has a name and use policy where you're going to expect acceptance, but it doesn't mean it's necessarily there. Yeah. Thank you.
Okay.
So our next question, now that you've established a career in this field, what would you say the climate is like at your place of work? And have you personally run into any difficulties because of your identity? Kathleen, do you want to start this time?
Sure. I mean, my response to this question is similar to what I was talking about before, because that is what the environment is like. And of course, I run into, like, you know, I'm in a minority, and I know that I'm in a small minority, and people just assume things about me, like I'm married or like I'm heterosexual, you know. And so I run into that all the time, and I have to figure out how I'm going to navigate that. How am I going to, you know, how am I going to respond and yet feel like I'm being genuine, feel like I'm advocating, and at the same time not offending, you know, not distancing, because that's not going to help anything, you know. But it does get really tiring. It's like the same thing over and over again, and it all has to do with, like, you know, our society is so built around couples, heterosexuality, and it's built around that. And so I get that people, it's what people are used to. And then when you're different, you know, they just don't know quite what to say or how to approach you or anything like that. So but you know, there are a lot of people who are just thirsty for that, because, you know, the trainings they've gotten or whatever I just don't take it to a personal level. And so, you know, then I can open the door and I can say, no, it's okay, you know, let's talk about this. Those are really precious moments when you hit people, and I'm dealing with people who are in the field of taking care of others. So, you know, I would expect a higher percentage of people that would be interested and wanting to learn absolutely as much as they can learn. But that's not necessarily always true, and it's not always somebody else's priority, you know. So, yeah.
Livia.
Yeah, I think so Planned Parenthood's a strange place to work, I think, compared to most other places. You know, I think the gender balance of staff too swings heavily, you know, to women, you know, by otherwise, and it's a different work environment. You know, I think queerness and a lot of the work that other organizations have been doing Planned Parenthood has done the work, in my view, and a state I've only been there for 3 years myself, to kind of live up to an expectation. And it seems like it continues to do so. But that doesn't mean that like everything is great. I think that being in the role that I'm at as an organizer, I'm often very front facing. I do I engage with community at festivals, at other places. So it has the same flavor, I think, as just existing in the world and going somewhere does to some degree. If I'm having a conversation with someone, because the tone of my voice, which is the first thing that will hit people typically, whether it's on a phone or a meeting like this, will kind of set people and their expectations a certain way. And so that they kind of like you were saying, Kathleen, they don't know how to, at least I think, how to respond, or they hadn't encountered the situation before. And so, I think that you deal with that. And that's a part of life, unfortunately, I think. But I think it's also, it can be an opportunity, if you have the energy for it, to challenge expectations and to be a little bit more comfortable, or to have people be more comfortable with themselves. I think being visible for me in those spaces has really provided an opportunity for people like me or other queer people to come talk to me, at events or otherwise. It makes the things I'm saying more meaningful, typically. And people really value that. And I think that's endearing. So I see that reflected a lot, just by the general populace, and gives me a lot of hope. But I think that also no one expects to have a trans person knocking at their door canvassing. I did that for a number of years before the job I'm in, or the kind of unexpected places that you show up, when you're in a professional role, and no one expects that you're bringing those experiences with you in a way that you can transmit. So I really like that. I think, for folks, it probably could be draining in a particularly difficult day, or, if others, if I, in my own experience, if I didn't work at an institution like Planned Parenthood, where I know my colleagues would have my back and they would be more understanding, it'd be a lot more difficult. But, I think something else that's been mentioned is that things are changing. They're getting a lot, I think in general, kind of, you were saying, Kathleen, that it's becoming more the norm to have these policies in place, and more incredulous when they're not. And so things have changed dramatically, even in a short period of time. I think, just for those that don't know, in 2013, I think it was 1977 or 73, when the DSM changed homosexuality in there, to reclassify from being a mental illness. And 2013, the reclassification of what was it? Gosh, can't even remember what the term was at the time. But either way, from being, gender dysphoria, gender identity disorder, to being a disorder, changing it to being gender dysphoria. So removing the connotation of disorder, and the number of health professionals in between that time who had their education before that date or education after that date, how long it takes for books to get updated. It's like a lot has changed very quickly.
Yeah, I mean, I was talking about that earlier. I think it's even like I was trying to lay out a timeline, but I think you're right. I think it is even more in the last 5 years that it's sort of really started moving. Do you have a sense as to where it's going from your vantage point?
I think that to kind of keep it in the frame of this conversation of healthcare, I think that yeah, well, that is a very broad question. It's a very broad question to tackle. Yeah, I would say I'll face it in the most honest way. It's going well. I think it's going in the right direction, and I think that people are reconnecting with elements of themselves that have been more repressed. Here in Wisconsin, there's a lot of anti conversion therapy policies that have been passing. I know, like in Appleton, kind of thinking about that. And also too, having an honest conversation about people who, I know this is controversial, but people who want those services too, or who are religious, to be able to find themselves in their religion as well, you know. And I wouldn't call that conversion therapy, but you know, it has a whole, you know, it's not as if queer people can't be religious or spiritual, you know, and that there's healthy ways to explore that. I think that youth, you know, something in the future here, that so part of the reason that things shifted so dramatically, I think, is because of the you know, that queer folk could get married, same-sex marriage. You know, I think that dominated the conversation for a really long time, and in the culture. And now that things are changed, it's kind of having a reckoning of like, well, what about the rest of it? You know, what about all the strange ways that people actually relate? You know, what about single parents? What about, you know, polyamory? Or what about, I think, really the crux of it, I think that stigmatizes people so hard, is what about kids? Queer people, now it's so much more easier for folks to adopt, you know, which I think is beautiful. But that's really scary to people who are trying to uphold a certain standard or a certain view of family. And so my partner, Edie Pasek, she runs Drag Queen Story Hour here in Wisconsin, and extremely controversial around here in Milwaukee. You know, she'll do an event at a library and have protesters show up to a book reading event.
Yeah. Yep.
Yeah. And that, you know, just kind of gaining access to kids and the ways that happens in schools is a big issue, you know. And part of that is, you know, their current policies right now in the legislature that seek to ban trans students in high school and public elementary schools from going to sporting events, even you know, anti-bullying policies for trans folks are kind of at risk right now. So again, I'm still very optimistic about these things, but I think that the future relies in a younger generation, you know, of queer folk having kids, which we know they do. I've seen statistics too, where younger folks really want kids. You know, it's like really close to kind of like the national average of just everybody. I think it's something like 41% or so, slightly less than half, all want kids of I think like 18 to 30 years old or something like that. So I'm optimistic about it.
Wonderful. Thank you for sharing that. So our next question, in your position, do you work with LGBTQIA plus individuals? If so, what do they report as the challenges they face in the community? Do these challenges differ based on either the queer and or trans identities or on their racial identities? And we're kind of going back and forth. And Olivia, you just talked a lot. Are you okay with starting that one?
Sure. Yeah.
Thank you.
Yeah. And I know I am generally talking a lot. I'm sorry. I'll try to be more brief.
Oh no, and I don't mean it that you're talking.
I want to hear from other people desperately.
No, not talking too much. You're doing wonderful.
I know. Yes, I appreciate you all. So I do work with some LGBTQI individuals, not as much as I would like to. Planned Parenthood Wisconsin right now has an advisory team for Trans Advisory Council for the healthcare rollout that we're doing right now, which is great. So I've had a great part in that. And that is entirely trans-based to inform our policies around interactions around trans healthcare, or gender-affirming healthcare in Wisconsin. You know, when I had an opportunity to work at some place like the Milwaukee LGBT Center, I ended up going to Planned Parenthood because I really thought that there weren't many groups that were Spanish speaking that were inclusive of LGBT people. And so while I still maybe can't say that I've developed it as much as I would like, that having this level of contact with the team of health promoters, Spanish speaking folks who work in community all across the state, you know, Madison, Racine, Kenosha, Platteville, Lake Geneva, Milwaukee, Green Bay. I think that might be it. Definitely, maybe Eau Claire is one, but I'm, you know, team of 30 or so folks that is primarily Spanish speaking. We do all our meetings in Spanish. And whenever advocacy comes around, I'm the one who's talking with them. And we do, like, I've done trainings on like family inclusivity, LGBT workshops around that topic. I've been at a home health party where they'll invite or be invited in by a family to talk about something on the curriculum. I went to one household in Milwaukee where a child of a parent, had told their parent that they were trans, or they were coming out as trans. And so they were like really disturbed by this. And thankfully they had a relationship with one of our promotores de salud, our health promoters. And so she informed me of it, and we were able to do a workshop with them about it. And it really flipped from just utter desperation and into a situation where they might have ended up, the child might have ended up being homeless or rejected by their own family, which is just deeply traumatic. Into a positive one where she was actually willing to like host her house to other people who are going through the same thing so that they might also have additional connections. So I don't work as much as I would like to perhaps directly with LGBTQI individuals, but I tend to work with everybody. And so that provides me a lot of catharsis because I think that work is also really important, and in the Spanish language.
All right, thank you. Kathleen.
Yes, I do. I feel very privileged because I see individuals for therapy who identify as LGBTQ+. And then, of course, at the opioid addiction clinic, I also see those individuals. And what is reported back to me is of course a lot of isolation, especially with the pandemic, difficulty finding support groups that fit, because there's support groups out there, but it's got to be a fit. Some improvement with technology, because now people can go to support groups that are across the nation. So there's one advantage there. I did have a lot of complaints about the difficulty accessing hormone replacement therapy. Of course, very grateful that Planned Parenthood opened the gates on that, and that completely has eliminated, like, since that happened, I haven't had one complaint about that. And that was getting to a point where it was almost at a fever pitch. I mean, it was just, there was so much desperation. And so I can really tell you that that's had such a huge impact, like super big impact. The other issue is that, in my field, if you go on the internet and you look up a counselor, most counselors say LGBTQ friendly, and there's pros and cons to that. Like there definitely is a con to that, because now it's just so common, you can't distinguish between who truly knows the community and can speak to the needs of the community versus people who are just clicking a box. I mean, that is definitely an issue. And it's even hard for me because I do a lot of, you would consider it case management with the opioid addicts. And so I try to get them connected with resources in the community. And I'm a provider, and it's hard for me to distinguish, like, who's who, what's what, who knows what. So that really exploded, that also has exploded. And I think it's evolving, and I think there's going to be a new way in order for you to identify who truly understands the community, like who's truly you're going to come in, because it's really hard when somebody searches for a counselor and then they start with that counselor and they think that that counselor knows the community, and then they realize that they don't. Then you see a lot of anger, you know. And so I hope to have some kind of influence on that whole thing, because I can see what a mess it's become. You know, it's really just become a mess. I mean, sure, if you happen to schedule with somebody who does happen to really know the community, and they know, like they can relate to you, or they can speak your language, so to speak. But if you take that time and then you're with somebody and you realize that it's not really, there's no depth to it, you know, you can see how frustrating that would be for somebody. And upsetting, you know, because why are you identifying like this, but you don't really know my community, and you don't even know what I'm talking about, you know. So there's some of that.
You know, as a LGBTQ plus resource center directors, I get so many people in the community reaching out, looking for both counselors and for HRT. And sometimes it's really hard to know what to say. So I need for you to repeat this, Livia, that Planned Parenthood is providing HRT in the Fox Valley.
Yes, we're actually providing it by telehealth statewide. And I also want to be really clear about that as well. So thankfully, one of the benefits of COVID, tragically as it is, has been that there's been a lot of loosening around telehealth services, and that has meant that hormonal care, no matter where you are, as long as you can do that kind of appointment, means that you can get HRT. Mind you, it's still only for those that are 18 and above.
Right.
So
Yeah.
there's still added complication for those that are younger than that. But I think that it's really good.
So what if a parent comes in with their 16-year-old? They still can't get it through Planned Parenthood?
They still cannot. Yeah, no. In that case, we would still always provide information, though. There is an internal list of where to refer for that individual. You know, so that would be typically like an endocrinologist, or you know, I know that Freudert here, Madison has another one. I'm most familiar with Madison and Milwaukee when it comes to those services, but even legally, it gets pretty difficult. Like even in those situations, like I think you need both parents to consent and provide that. Yeah, which is
there are barriers. You got to jump through these hoops in order to get where you need to go. Yeah.
Yeah.
And in the Valley, we have very limited people who are willing to take those cases on. So, but they're there. I mean, you just have to, it's just hard. It's difficult.
Okay. So just quickly, another question. Is Planned Parenthood an informed consent clinic, or is a letter from a counselor required for HRT?
Excellent question. I'm going to say very heartily that it is an informed consent clinic. And to define that means that, you know, you'll kind of like most other things you'll be getting anyways when it comes to a procedure or otherwise, that things will be explained to you in terms of HRT, which would be like, what are the short-term effects, long-term effects? You know, do you have any risks? Do you have diabetes? Any other things that might complicate administration? And health background history, and then you'll make a decision about whether or not this works for you. So definitely informed consent.
That's exciting.
Yeah, we were notified that it was all informed consent, so that's why it was. I mean, that's just so exciting. It's so exciting.
Yeah, I mean, our students have to drive to Chicago to Howard Brown for an informed consent.
I've done that too. I did that for years.
Yeah. All right, back to our scheduled questions for today. So in what ways have your intersecting identities, sexuality, gender, race, class, religion, ability status, influenced your path in your career? And are there certain times when some identities are more salient than others? And now I can't remember who started first last time.
Okay.
I think this should be Kathleen.
Okay.
That's I don't know. That's a hard question. There's a lot in there. Definitely, like my identities definitely influence like what I do for sure. But it really is more about diversity in all aspects of diversity, you know, just being able to, you know, when we talk about, you know, ethnicity or faith, spirituality, religious, whatever you want to call it, gender, you know, sexuality. When you talk about those things, or however, you know, I identify, I just try to use that and my experiences over and over again of being reminded that any kind of difference from the norm causes some kind of friction for people in general. And you know, so to work at, you know, trying to open the gates, so to speak, on that more and more, and to continue to work on inclusivity and diversity. Those are exciting topics for me. It's not always easy, but there's so much reward. There's so much reward when you can, you know, it's not necessarily about me, but I think you alluded to this before, Livia, that, you know, whatever the people you are working with, whatever they're going through, you benefit from that as well, because, you know, it strikes a chord in you or whatever. And so you benefit from them. And so in a way, you're kind of growing together. So if I'm helping individuals who don't feel like they have acceptance and understanding and all of that, at the same token, I'm gaining more understanding and more acceptance at the same time. And so I think that that's how I would answer that question.
Livia.
Yeah, so I think for me, I think I've covered it a little bit prior, you know, when kind of talking, I think of something about like how the things that I learned, you know, and I'll state this too, like my mom, both my moms, I've got two moms. One of my parents is also trans. And so, but both of them were organizers growing up. So I already had a lot of skills. Thanks to them and some comfortability there. But I think that my kind of mixed background between being, you know, having Mexican heritage and having other, you know, my other side of my family been here in the United States for generations, so far back that they can't identify where they came from, has definitely influenced who I am and my career. I really value being able to speak two languages and having family in Mexico that, in the context of this conversation, accepts me. You know, that was extremely important to me because I'd been so kind of, you know, to a degree, like othered, a little bit different, you know, just by fact of being like, I'm in the US, my name, you know, has Ortiz at the end of it, you know, in school. And so here I'm like really identified as Latinx. But when I went to Mexico and to see my family there, I was really identified with being American, you know. So there was kind of, you know, it's kind of, it can be kind of cute, you know, it gives you, again, something to work with. But, you know, so you still have to find yourself in that. I think that, you know, the identity is such a broad thing in terms of how we see ourselves and where we want to go, who we are, that being able to be sensitive to those, to that is a skill and something that you're constantly working on. So I try my best.
All right. I think our final set question, then we're going to open it up to questions from individuals that from the audience here. What advice do you have for LGBTQIA plus students who would like to go into community health care? And I need to have somebody start. Gosh, Liz, I forgot. I think it's Livia. Yes. Sorry.
LGBTQI students who would like to go into community healthcare. I just think that, you know, one of the things I told the physicians at Planned Parenthood when we would start getting trans patients is that, you know, your patients are going to want to come see you for everything. You know, we don't do primary care, but I know for myself, you know, when I found one person, you know, who was able to like see me and treat me fully, and provide me really good healthcare that that wasn't shortchanged, it was, you know, I really clung on to that. I think a lot of people do, and I know even at Planned Parenthood offering hormonal care, I know people will come in for everything. You know, it's just we just anticipate that. At least I do. So you know, I think that you know that you will be those people for others, and that's really really awesome. You know, I think that it's, you know, being queer, being LGBTQIA is changing a lot in perceptions at work and society, and you know, and even I think healthcare for everyone is changing dramatically. So, you know, the intersecting part of who we all are, you know, is at stake in that. And so I think that no matter who you are, you'll find something of value in being someone who cares for others, and has a way to actually act on that. So I hope that would, you know, would give you energy to move forward, and you know, and pursue that at least.
All right, thank you, Kathleen.
Yeah, so healthcare and mental health care, if we're talking about healthcare, you know, careers and things like that, has changed so much. And in some ways it's unfortunate because it's very productivity and financially based. I mean, those priorities really are paramount. The reason I'm bringing that up is because it comes up over and over and over again that it has faded that healthcare is going to encourage individual workers to take care of themselves. They will work you to the ground. So what I would say is number one, it's so important to prioritize self-care and get those habits in really, really well. And then on top of that, you know, especially for LGBTQ plus queer folk, you know, you're not necessarily going to have the support that you need and within your system. That doesn't mean you can't fight for it. That doesn't mean you don't have rights. That doesn't mean you can't advocate for it. But what I would say is you really, really need a strong external support system. So that, you know, when you're going into a system where you're going to be in the minority, and you know, your voice may not always be the one they're listening to, it's really important for you to have people that do understand you really well, do support you really well, so that when you go back to that system or that environment, it doesn't drag you down. Because I would agree that there is so much reward in being a provider, being somebody who provides any faction of healthcare, whether it's prevention, outreach, you know, direct care, whatever it is. There's so much satisfaction to give to the community, to give to people who are in need. And that's a real privilege, and it's an honor, you know, it's an honorable, I think, field to go into for sure. I mean, I just can't even imagine what would match that. But I also would say, you know, be realistic in what your expectations are, and know that you have to take care of yourself. You have to take care of yourself, have to be able to set really good boundaries and limits, because these systems are, even with COVID, they're even more pressure. So there's so much pressure to give beyond. And so you're the one that has to say where it ends and what you can give and what you can't give. Those are really, really important things that you need in the beginning, in the middle, in the end. You need it all along.
So our speakers have given us so much to think about. I'm curious, for those in the audience, what's going through your head? What questions do you have? You can raise your hand, you can unmute and speak, you can write it in the chat, and my intern Kaylee will read it for you. What questions are out there?
I just dropped something in the chat meanwhile while we wait. That is, so we do employ, I forget their exact title, but you know, a healthcare navigator for hormonal care. And so anyone that is interested, or for anyone that is a provider, that Max Levy is our you know, healthcare navigator, and they will do one-on-ones with anyone, and they have the power to make appointments too. So yeah. That's information that if you want to know more, definitely reach out to them.
Thank you.
I, Kaylee, the intern, have a question. I've heard many personal stories about asexuals and different people of the community that the healthcare system has treated them as broken. When you get patients like that, how do you address the issue and explain to them that they're not?
Did you say asexual?
Yeah.
Yeah.
Do you need me to explain the term?
Oh, no. I'm just saying, like, again, like, who in the world would even say that? So who's ever saying that obviously is not sensitive to the community. Like, they don't even understand what they're talking about. Like, you know, this falls within the spectrum. Sure, I talk to people about that. I talk to clients about that. And, you know, like other identities, right? It's about understanding who you are. It's about, how do you want to be understood? What is important to you that other people understand about you? And that you don't have to tell people things that that are necessarily not going to be helpful to you. And it does go back to educating people about not assuming that because you're seeing a healthcare provider that they even know, like they even understand the full spectrum of identities. Like, that's really, really important for, I think, the community support groups and everything, to get the word out that you know, tread lightly until you know, like Livia said, I finally found a healthcare worker that I really connected with, provided really good care. That's what has to happen. You have to tread really lightly, and you're better off assuming that they don't understand, that they don't know, you know, and that it's going to take a while to find somebody who really understands. You know, but of course, I would say you're not broken at all. I mean, it's your identity. It's how you express yourself. perfectly fine, but I understand the hurt. I understand the anger and the hurt that comes when you get messages. I mean, I think that people with lots of different identities get that message, and it's, whoever is giving that message, right? They're the ones that are the problem, like, right? They're the ones with the problem. And if we can educate people, like, that's a reality, because I think it happens also because of the power imbalance. There's such a huge power imbalance, right? You're going to a healthcare provider, and in a way they have power over you because they manage your healthcare. But what I teach people is that weird irony, like yes, there's that power imbalance, but the other flip side of it is they work for you. They work for you. So if they do not know what they need to know for you, if they're not providing the care that you need, right, then this is your right to have the health care that you need, whoever you are, right? So I hope that's helpful.
It is.
Any other questions?
You can put them in the chat. You can unmute or raise your hand on here.
I'll say that I hope that we're going to see more healthcare navigators, because that's a newer role. And it's so, like I mentioned earlier about what's happening with our health systems and our mental health systems, there's so much pressure on these systems because the demand is so great, especially with mental health. We are seeing the demand is just skyrocketing with mental health. And we really do need patient navigators, because people have difficulty navigating these systems, these really, really difficult systems. Like even for myself, like when I access healthcare myself, and I'm a very seasoned professional, even for myself, I can myself experience things that I feel like are, wow, that's really judgmental. Like that's really like coming to quick conclusions, and can we slow things down here? But that's the pace of healthcare. It's like, get them in, get them out. You have to be assertive and know what you need, and be willing to say it, be willing to speak it. Otherwise, somebody else will decide for you the direction of whatever care you're getting is going to go in.
Absolutely. So I saw a few people typing, but it's not showing up in chat. So I'm going to say we have a few minutes left here. If you want to ask a question, please unmute. We may begin a delay with the chat here.
So while we're waiting, I'm assuming I'm not the only one who doesn't exactly know what a healthcare navigator is.
Yeah, I could talk about that a little bit. So for us, that is someone who lives within the so this person at Planned Parenthood lives in both our education department and our patient services department. Not every institution will have an education department, but it basically means that they're going to be informed by the latest up and coming information, and be well connected. And this is the part of our agency that does trainings for the rest of our staff, and so they're based in there for us. That's what it means for us. I think in this next part is going to be more general to the term, which is that it's kind of code word for for someone who in other situations might be a social worker, someone who is much more, like specific, very specific, like to And I want to stay away from associating that with social worker, like to be really clear about that. But it's someone who can work on a one-to-one level, navigating individual issues that we have. So even in the case of someone who is like 18 or under, you know, our healthcare navigator can help them figure that out, even though they can't get an appointment with us. If they're looking for an LGBTQ support group or something, you know, and they're a patient or a prospective patient, you know, they're really kind of supposed to be someone who is a Swiss Army knife of figuring out how to connect the resources that we have and know about to that individual. Of course, they're not going to be able to solve every problem. They are not a social worker. They are not someone who is able to do that regularly, you know, but they are able to work on an individual level to try to make it work, so that they can get something like hormonal care, or even just like, frankly, like STD screenings or like cancer screenings, like the rest of the services that we want for. You know, one question that I had, you know, when we were going through hormonal care and prior was, you know, how supportive or how inclusive are our abortion services? You know, like that is a very difficult time for someone to be going through something and then be misgendered or like have something, you know, go awry or otherwise, you know. And so I think that, you know, healthcare navigator is someone who can, you know, kind of pave the path a little bit for anyone that is having any worry ahead of time. And it is, for us, it is largely focused around gender affirming hormonal therapy, but I think for trans folks more broadly, it, you know, that is the role that they play in our agency, of trying to be able to meet the challenge. I don't know what it means at other institutions. Certainly the mantra, you know, and just, you know, Kathleen saying over and over again that folks are overworked, don't have enough time for conversations. Like we hear that at Planned Parenthood as well, you know, for our clinicians. They always want more time, you know, and I'm not a clinician myself, so I don't know too much. You know, I can't even get 10 to 15 minutes to talk about election work often. You know, you have to really schedule things out like a month ahead of time. So from my end, that's what that looks like, you know, is that there's still kind of that inflexibility, and that's very serious. You know, so I, you know, really cannot highlight that, you know, in the way that Kathleen can, but I see it.
And I can speak a little bit about the healthcare navigator, because there's actually mental health navigators. And so if you think of it in terms of, I'll give an example. Say somebody has a chronic health condition, but then they also have mental health issues. The navigator, I think of the navigator as having more knowledge about the systems and how to navigate through, how to maneuver through those systems without being too jostled by, because I mean, you can feel sort of like it's sort of like you're just a number, or, you know, people aren't really paying attention to, you know, what your particular concerns are. And then I also think of the navigator as kind of a buffer, because, you know, these systems can feel sort of like jagged, you know, like you're going through them and they're it's not smooth. It's not like a flowing system. And also the navigator keeps these connected in some ways, if they can, you know, like obviously there's time limits, but, you know, I really, really love the role of the navigator in our modern healthcare and mental health systems, because I see more and more people need them, because, you know, they come to a point of exhaustion where it's like, I've been looking in this system for what I need and I just can't find it. The navigator can maybe pull something out and say, actually, I know about this person over here, you know, and we're going to send you over there. So I think of it like lots of different roles: buffer, navigator, you know, support person, cheerleader, encourager. I think of it that way. And I really, really think that those navigator positions are going to be even more important as we go forward.
Thank you, Kathleen. I know we're out of time, but someone actually had the courage to put a question in the chat. So if anybody has to leave, thank you so much for being here. But I'm going to have Kaylee read our last question.
You bet.
All right, so the last question is, what has been the most rewarding experience you've had at your job relating to the LGBTQ health/patient?
Oh man, honestly, loving being able to offer hormonal care right now is just really, really great. It's one of those things where I'm like, before it came out, I was like, we have to be really, really looking to do this well. We have to be looking to do it not at a minimum, not at a base level, but like trying to see how this incredible data that we're getting, 24 health clinics across the state. Mind you, it's only offered in 3 physically right now. Like that will change moving forward, but everyone, all clinicians have had the training. Every clinic will get it though eventually. And the fact that Planned Parenthood affiliates, for those of you who don't know, Planned Parenthood, there is Planned Parenthood Federation of America, and then you'd have like Planned Parenthood Illinois, or some that cover multiple states. Being a nationwide network of hormonal providers in an era where there's so little documentation about what the effects are, what the long-term effects are, how your reproductive rights are handled if you want to have kids, and for anybody. I think that being able to stand kind of shoulder to shoulder with so many awesome healthcare advocates has been incredible, and community members. It's something that I think really works close to human dignity and the value of human life. So yeah, I think this time right now is really, really good.
And for me, it's being able to see LGBTQ individuals find safe spaces where they don't feel like they have to protect themselves, where they can truly explore who they are and allow that process to keep moving along. I mean, it's so rewarding to be able to find those safe spaces and then honor them, and let that be what it is. So that's very rewarding.
I cannot thank you both enough taking time out of your really busy days to be with us this afternoon. It's been a joy. For anyone who's still here, if you could fill out our evaluation that Kaylee's put in the chat, that would be fantastic.
Yes, thank you both. You're amazing.
It's been a pleasure. Lovely meeting you all.
Yes, same with you.
Thank you.
Yes, thanks. Thank you, Kathleen. Thanks, Livia.
Take care.